Welcome into To Your Health. And we have back with us, we are very fortunate to have Dr. Wick Many, who is an infectious disease specialist. And with the things that are going on right now in our environment, there is no better person to talk to us, because what he tells you is well founded in science and in knowledge, years of knowledge. And we are going to talk today about something we've had so many questions on, and that is monkeypox. What is it? What do we need to know, and what do we need to do? And this is the man, you're the doctor, to tell us.
Well, thank you for having me. So monkeypox is a viral illness. It is in the same family as smallpox, but fortunately it is much less lethal and much less contagious. We have had very small clusters of monkeypox in the United States in the past, and those have occurred when people brought in exotic animals from areas that monkeypox is endemic, primarily Africa. So people would bring in an animal that was quote unquote a pet and would acquire the disease from these pets. The disease is a viral illness. It causes fever, sort of muscle aches and feeling lousy, sometimes swollen, tender, and large lymph glands, and then the characteristic rash, which is just a pox. It's just like this looks like a regular smallpox lesion. It's a circular pustular lesion, and sometimes it has a little indentation in the center of the lesion. We have now started to see a significant number of monkeypox cases in the United States, over 4,000.
Okay.
We have had several cases in Alabama. We have had numerous cases here in Montgomery. Monkeypox is transmitted primarily by very close contact with infected material, so the pustular lesions, the skin lesions. It is very difficult to be transmitted airborne.
Okay.
You have to be in a room with a person who has monkeypox for at least 3 hours and be within 6 feet of that person.
Wow.
Okay. So you would have to have a very intense, prolonged exposure to have it by airborne transmission.
Okay.
It's almost exclusively by contact of one of the infected lesions. We have seen a significant number of these lesions in people who have sexual contact. So during sexual contact, there's close bodily contact, and therefore there's transmission from these lesions from one person to another. There have been, unfortunately, 2 cases in children, small children, and that was household transmission. In other words, somebody in the house had the monkeypox, and the child in some way got contaminated with the fluid from one of the blisters. So it has to be close contact, physical contact, with these lesions to cause transmission. If you are of the generation of my friend here, Ms. Whitfield, and myself, and got a smallpox vaccine, you have partial immunity. Not great, but you have some immunity. There is a specific vaccine for monkeypox. It's in limited supply, but the CDC and the public health departments are ramping up the availability of that vaccine. And there is an antiviral drug, a pill that you can take to treat the monkeypox. Thus far, of the cases in the United States, over 4,000, no one has died. So it usually gets better within 10 days. Who would I treat? If I had to treat somebody with monkeypox, it would be somebody whose immune system is in some way injured. So if somebody's on chemotherapy, if someone has HIV infection that's not well controlled with medications. So again, the drug is available, but you do have to meet certain requirements or indications to receive the drug. The drug, you have to get it through CDC, so it's going to take some paperwork, but it is available. But I think for the general public, just be alert, be aware, listen to what your public health people are saying. But I think for the general public, it's not something that is going to be transmissible airborne. As I mentioned, it requires a prolonged, very close contact to have transmission by airborne mechanisms.
Well, a quick question. Let's say, we all go to the grocery store. When you're talking about any kind of contact, so suppose that you have somebody who's been there, they've had your card or whatever, and they've had those lesions. Can you get it from that kind of contact?
Yeah, theoretically, you could. It can live like on the bed sheets. if somebody who's had it, so if you're changing the bed linens of someone who has it and not wearing gloves and gowns, that's a possibility. So if you're going to go to the grocery store, or it just makes common sense to use the hand sanitizer.
Right.
The hand
Okay.
sanitizer that's available in most grocery stores and other big box stores, if you wipe the cart down with a hand sanitizer or have your own hand sanitizer,
Right, right.
then you're in good shape, no problem.
Okay, that is good to know. This is not something that we need to get in some big panic over. We just need
Definitely
to
not.
understand
Definitely not.
and be wise.
So, the infectious disease community is keenly aware of it,
Right.
and is ramping up. We just sort of already ramped up for COVID. Now we just get ramped up for the next one. So there's always going to be the next one.
Well, thank you to all of you, and thank you so much, Dr. Many, for coming in, being with us. We appreciate you.
Okay, thank you very
And
much.
stay with us, and we'll be right back.